Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. The Black Health Coalition of Wisconsin was incorporated in 1988 with 12 organizations. That number has continued to grow, and since its inception, the Black Health Coalition has been at the forefront to health issues that have impacted underprivileged populations throughout the state of Wisconsin. Dr. Patricia McManus and Claude Gilmore spearheaded the citywide coalition, and Dr. McManus joins us today to discuss the efforts of the Black Health Coalition of Wisconsin. How are you, Doctor?
I'm good. Glad we're still here.
Thank you so much for joining us today. And the Black Health Coalition operates using two primary guiding principles: empowerment and inclusion. Talk about the importance of those words in what it is you do today.
Well, in a city like Milwaukee, in which you have the most impoverished people, and certainly the most impoverished people is African American, that most things are done by people outside the community for the community. And when we were putting that together back in '88, one of the things we thought was important, because one thing about empowerment is that you hear people say, well, I want to empower these people, but empowerment is an intrinsic word. It has to come from within. You can help people get information, resources, knowledge, but they have to do it. And part of that struggle still continues in terms of having folks understand that they cannot empower a community that they're not part of. So, and then the inclusion is, but we also recognize that we cannot do everything ourselves. That's where the inclusion comes in.
Gotcha.
That we have to collaborate and coordinate and work with others. But that inclusion would be meaningful inclusion. So when we sit at the table, that table is an even table that works, in which we have input in what we need other help for.
Gotcha.
So that's really those two.
You've done an outstanding job in pulling organizations together to make a difference in the city, and you operate several coalitions: the African American Mental Health Task Force and the African American Task Force on HIV/AIDS. And there are statistics that really help drive home the importance of what it is that you do. According to the U.S. Department of Health and Human Services, adult blacks are 20% more likely to report serious psychological distress than adult whites. Adult blacks living below poverty are 2 to 3 times more likely to report serious psychological distress, and black teenagers are more likely to attempt suicide than white teenagers. When it comes to HIV/AIDS, African Americans have the most severe burden of HIV of all racial and ethnic groups in the U.S. So talk about why that is.
Well, part of that is there's a lot of discussion around about health disparities.
Yeah.
And another thing about when we incorporated the coalition was that we looked at the World Health Organization's view of health, not the United States. The United States does not have a health system, they have a medical system. And health looks at all the social determinants of health, and like poverty, like racism, many other things. And so when you look at health disparities and you understand that, then, and there's this whole discussion around what's called a cumulative disadvantage. And if you look at, we're talking about centuries, you know, of people that have been impacted, and they really are finding out through genetic testing and what they call biogenetics now that a lot of changes occur, and when people are in situations like that over time, and so it affects their ability for them to not be healthy. So
it all makes sense.
Right. I mean, we certainly have people who, I mean, clearly you have a responsibility and behavior in terms of things occur. So we have folks that, everybody doesn't do what they should do to do that, but the disparity says when you control for all that, it still doesn't make sense that it's so high, that the numbers are so high. And a lot of it has to do, place matters, I guess is the best place to put it. Place matters, and so being in a hyper-segregated city, and I've had folks say, well, Milwaukee can't be like that, but what they don't realize is that it is because, like other cities, like a Chicago or LA or other places, Atlanta, those places at least have a middle class or upper middle class black suburb. Milwaukee doesn't have that. Milwaukee put in some real strict codicils back in the day, and when they started to migrate and develop suburbs. We still don't have that. And so
interesting.
So that's why the segregation is so high. 98% of black people live in pretty much 7 or 8 zip codes.
And it's interesting that you said you use the world numbers when looking at health. And when you talk about infant mortality, although we have seen the numbers get better here in the city of Milwaukee, but the numbers have been compared to those of third world countries. So that's scary in itself. And African Americans have 2.2 times the infant mortality rate as non-Hispanic whites, and 3.5 times as likely to die as infants due to complications related to low birth weight as compared to non-Hispanic white infants. So quickly want to talk about some of your programs and services that lie within the Wisconsin African American Eliminating Health Disparities Institute, your HIV/AIDS program, and Healthy Beginnings in a nutshell.
Right. Well, the Institute actually started about 12 years ago, and we actually created we have a walk every year for quality health, and that kind of funds that. And that allows us to get a lot of information out about what we're talking about. We do a lot of community education around health disparities, around historical trauma, around how that trauma over years and years and years and generations creates people who maybe can't do what they normally would do.
Yes, ma'am.
What it also doesn't do, though, is show that we have a great many people in our community who do very well despite the circumstances. The ones who don't do are the ones you hear in the paper, the ones that people always talk about. But we do have a lot of people that are doing well, and we use them to help other folks figure out what to do. So as you mentioned, HIV continues to be high across the country, and all those U.S. numbers, they almost double when you get to Wisconsin, and you look at the numbers, they're even worse. And mental health, almost double. When you look at, how you depressed about being your life?
Yeah.
And they ask a question, how's your day? And Black people invariably have a harder time and speak to that, and a lot of it is the reason why. So our programs have always been tailored to what we need to address. I talked about the fact that we knew that place matters, so we've always been at the table trying to deal with housing and transportation and all these other things, because we know jobs, that makes a difference in how people see their lives.
Difference.
We also, with Healthy Beginnings, though, that was our program that we had for the last 15 years that we still have, but we were funded federally to deal with infant mortality. And again, it's interesting because our numbers, we have a very tight, very rigid evaluation. So the clients that we work with, we have exceptional numbers. But if you don't have enough money, you can't spread it out to more people. And so we're still going to certainly put that out there. In the HIV program, we've always been able to, we have a task force, like you said, to work with people, to get them to have people who have HIV or people who are at risk for HIV to talk and have a say. We actually have a state certified HIV education program for pastors and their ministerial leaders to deal with the whole stigma and discrimination.
Yes.
Because when you talk to people about HIV, people who have it, especially African American, their biggest struggle is the rejection by the community.
Yeah.
And you can't fight something so horrible as HIV in your system if your spirit is so affected. So we've been doing that for 5 or 6 years now, and really have pushed the clergy, the African American clergy, to understand that.
Yeah,
you
and before we run out of time, speaking of the African American clergy and others, a huge focus of the Black Health Coalition of Wisconsin and the Milwaukee Inner City Congregation Allied for Hope has been the new MCTS routes 279, 61, and 6 in relation to job access. I think this is huge. So due to a settlement agreement between representatives of your organization and MICA with the State of Wisconsin Department of Transportation, this suit alleged that $1.7 billion for the Zoo Interchange reconstruction and expansion project approved by the Federal Highway Administration did not adequately address the needs of persons who rely on public transit. So here we are with these 3 routes that have been added that are making a huge difference in the lives of people who live in the inner city.
Well, they're certainly trying to, at least, because these, again, with that suit, the suit actually looked at, when I talked about the insular way that we are in Milwaukee, we have all these suburbs that surround Milwaukee, but none of them allow Milwaukee County buses to go into the areas. And if you look at where the jobs are, there's some data out there the last year that speaks to the fact that 10 years ahead, Waukesha County will have 74,000 net jobs.
Wow.
Milwaukee County will have 300.
Wow.
I mean, so you got to go where the jobs go.
You got to be able to get to the
People
job.
have always gone where a better life is, but if you can't do that, and in the last 3 or 4 years, we've had tremendous cuts in transit out of the state budgets. There was 2 years ago, we were actually looking at not having any buses run in Milwaukee on weekends or in the evening because it was going to be cut so much, which is unbelievable.
Unbelievable.
Most other cities have regional transit. You know, you go to, they can do it. We don't have that here. So if transit is the way you got to get places, and especially in a city like Milwaukee and trying to get out to these jobs. And certainly, and again, we've been dealing with this for over 10 years, working with the ACLU, who helped write the decision, you know, in terms of the complaint. And to say that we've got to be able to do this in a way, so we've got these, it's 4 years that we got a total of $13.5 million to put these routes out there so people can go out and get a job. But we still have to have some cooperation, or lack of a better word, from Waukesha. And actually, it's been pretty good, really. We'd like it better, but it's still hard to get the workers, the employers, to believe that they're good workers in the city because they get such a negative view. You know, I always tell people that we don't have a violent community. We have a community that has violence. Language is everything, how you use the words.
I gotcha.
You know what I'm saying? So
yes,
there's a difference there, so that's not all who it is. So we've been working, and we've been working and gradually getting more and more employers, I think, to really be understanding that, no, we do have people, some have no skills, some have a lot of skills because they've just lost their jobs. And so to work together, but we're hoping that between MCTS and Waukesha, that we can at least keep one. I like to see them all go, continue, but at least to continue that into after that money goes. So we're hoping that it's just not dries up after that, because we have people who have gotten jobs and who are out there. Still a long way to go, an hour or so, but we've got some folks who said it's an hour, but I can pay my bills now, and they're very happy.
That's major. So it goes to show transit and jobs definitely go together.
Go together.
Thank you so much. I'm sorry we've run out of time, but you're welcome to come back anytime to talk about this and other things that are important to our community. Thank you so much.
Thank you.
Dr. Patricia McManus is the president and CEO of the Black Health Coalition of Wisconsin. Call 414-933-0064 or log on to bhcw.org for more information on anything that we've discussed today. That's going to do it for today's show. I'm your host, Andrea Williams. As always, I thank you for watching, and I hope you join us again next week as we take another look at Our Issues Milwaukee. Have a great day.